say good afternoon. I hope you guys are having a phenomenal day. A little bit colder, as I was saying, but sun is out, so still looking forward to being out there today, doing quick walks and just getting that fresh air. I want to thank you, all of you, for spending your afternoon with us. If this is one of your first times here, I just want to tell you a little bit about what we do. This is a platform where we get to chat with our subject matter experts, and we want to make it an open forum for all of you to ask questions and speak to them directly. Last week, we had Zayna come in and talk a little bit about the future of healthcare, and she blew some minds away. I mean, I've had someone tell me that she was one of the reasons why they took the biology program this upcoming year. So, I mean, Zayna definitely is that person that creates that impact. And so today, we're going to bring powerful perspective and insight into what citizens, employers, and policymakers must do today to enable and even catalyze positive change for tomorrow. This is going to continue the conversation from last week's Lunch and Learn and go further into the questions that a lot of you guys had last week. And so, Zayna, maybe you can give us a quick recap on maybe a short 5 minutes on what we spoke about last week, and then we can go into some Q&A.
Yeah, thanks, and hi, everyone. I look forward to having a bit more space for discussion. I know we ran out and the questions were very juicy last week. So, I mean, I think, a few points. One is, who would have thought that a healthcare challenge could bring our $80 trillion economy to its knees? I mean, that really was brought into relief this week when the price of oil went negative. That means oil companies will pay you to use oil. And so here's this industry that used to operate separate from the capital markets, is now fundamentally linked. So those of us like me who've been working on creating the future of health and the future of healthcare, trying to modernize our health system all over the world so that it could be there for you and I when we need it, where we need it, and at a cost that's acceptable to ourselves and to society. That's what we've been doing, and it's been on a path, and we're going to get there. I mean, healthcare and maybe education have been the two sectors, and notably public goods, that have not yet modernized in the digital era. But this pandemic has now accelerated all of those shifts and trajectories that we've been on to modernize healthcare. We've now seamlessly blended kind of digital and physical experiences, just like you experience in everything else in life that used to only be physical. We're using data to inform not just policy decisions, but day-to-day decisions. So an intelligence-based health system, new ways to deploy resources. We're not forcing these big silos of nurses can only do that, and these people can do that. Just busting barriers left, right, and center because we need to get on with it. So producer interests are getting parked, and just a massive explosion of innovation and regulatory pathways to approve like new products and services that people need right now instead of waiting 10 years. So big acceleration. And then my last point is, and we kind of reflected on this, every other industry has also accelerated its own innovation for two reasons. One is their business model no longer works right now. So you have a choice. You can kind of shrivel up and go away and decimate a lot of jobs and a lot of long history, or you can reinvent yourself and rebase. And we've seen that in grocery, in retail, in restaurants, in education, in public goods like libraries and art galleries. And I mean, you name it, everyone has figured out how to pivot their business model, either to come help us out in healthcare and make gowns and make visors or make new data surveillance solutions, or they've pivoted their own business model to solve new needs for people who need to access things and they can't do it physically. So that's kind of hopefully a few of the key points around the amount of change that's happened, and that is going to really give us a better momentum to get faster to the future of healthcare.
Mm-hmm. And as we discuss the changes that's going on in business, but something was brought up, there's going to be changes within people as well. Like, what are we looking at in terms of the barriers that might come up right when we get back, when this settles?
Okay, first of all, there is no back. There's no going back to whatever the there's a new BC, before COVID. So there goes, Jesus in the Bible. But so whatever is the new normal, first of all, won't really settle for at least 18 months to 2 years based on our best understanding. So we've got this weird 2-year period of a lot of ups and downs and experiments in that, and then some new normal after. And so I think, yeah, most analysts are saying somewhere between 50 and 80% of new behaviors, new regs, new whatever will stay. And that's distributed in different ways. And then, 20 to 50% might go back to what it was before. So I'll just give you a couple examples. So, Tata Consulting Services, I think it's the biggest IT consulting company in the world. They just announced yesterday that they will eliminate 75% of all office-based work. The work doesn't go away, the real estate does. And that's what they're doing now, and that will just be what they go back to. And that's going to drive a massive productivity gain. In healthcare, depending on what use case or need of a patient, we think about 80% of what used to only be done in an office-based visit or a home visit does not need to happen that way anymore. So that's just going to change a lot about the economics, access, control and agency of patients and their families. When they don't need to go to the care kind of comes to them. And so it's just going to be fascinating how that all plays out.
Oh, it is true. I mean, you guys can hear my dog in the background. It's things are going to be very different, and so we are going through those shifts. And Zayna, there's something that I was actually curious about from the last time we got to talk with you, and we didn't get a chance to go deeper into it. But we talked a little bit about long-term care, but we didn't really get to go into depth of it. So can you maybe talk to us a little bit about the current status of long-term care?
Yeah, so again, in most places around the world, I think the only place this isn't true is Ontario. The word long-term care means, the longer term care, particularly of seniors who are starting to accumulate health issues and mobility and need a lot more supports. And so that's an actual system, just like you have a child health system that has a bunch of different levers. In Ontario, for some reason, we equate long-term care with buildings that people go to that are funded by the government or some kind of copay. So just to be clear, that piece of true long-term care, like what happened in Spain and Italy and everywhere else in the world, is almost like a perfect festing pool for viruses and bacteria. And that's exactly what's happened with, breakouts. And I think a disproportionate amount of the people who have unfortunately passed from this disease come from those sites. And so there's just a very big crisis here, Quebec, to some extent, BC, Alberta, to just get in there and try to contain that. And there's a bunch of levers. I mean, I think the military is in Quebec in the long-term care homes. Here in Ontario, we're redeploying some staff to just go help out of hospitals and out of home care and other places. So it's a huge challenge, but that's the challenge right now. I mean, 2 weeks ago, it was all about hospitals. We were obsessed with getting them ready with ventilators and, canceling all surgeries so that they could be ready for a surge. This is the new thing. And remember, 4 weeks ago, it was all about travel. All we cared about was who's coming and going on March break, So let's see how long this one lasts, and then we'll be to our next round of crises. And that's going to be around mental health of people and then just all the issues with labor and wages, I think.
Mm-hmm. And so what is your vision on what we can do to prepare for this now? I mean, the future is slowly creeping in, and now is the time to take that action.
Yeah, so I'm just looking at, some of my favorite people that are shift disturbers in healthcare are on this chat. So there's those of us in the sector, and I think we've got a lot we're doing. I won't kind of opine too much. I think for, the average Canadian or civil society who is both a funder and a user of our healthcare system, and if you're an employer, that wants to keep your people healthy, because healthy workers are, amazing workers. They do awesome things. So I think it's a few things. I think, be more courageous and willing to try new things. So just for example, we had a respirologist appointment for my 10-year-old who developed asthma suddenly. So we had to get a specialist to see how serious. We've waited 4 months for that appointment. And my kid literally will stop breathing right now if he gets too excited. So it's a pretty important appointment. And my husband's like, I guess we got to cancel. I'm like, no. We're calling the respirologist and we're going to ask them to do a virtual visit, even though they didn't offer it. So I think that's what I think you got to do, is be willing to try things, experiment, be patient, learn with us, and push the boundaries yourselves. Everyone, no one agrees really what the answer is, the future of healthcare. Everyone's got their opinion. What everyone agrees is patients and their families are going to pull us to the future. If they don't, we can all do everything we want. It's not going to work. So demand more. That's my advice for people.
And that is awesome. And so maybe you can perhaps give us an update with what's anything that's come out of the systems, like what's happening in the systems at the moment.
So some of the highlights kind of I made of where, barriers that used to take 10 or 15 years to bust through came down, and, it took 10 days. More has happened in 10 days. So things like, they're pretty basic, but, making it count that an interaction that's virtual, like what we're doing, counts as work that should be paid for. That happened in my sector in home care. It was kind of on that path with your doctor visits, but it really is now allowed. So there's things like that, like reimbursement barriers. The other are just regulatory barriers. So for example, very quickly, this highly, highly regulated sector of long-term care homes, some, rules were changed or relaxed. So for example, who can go work there, around, if you really want to take your loved one out of an infected home, and then they can go back in, that you're not back to the bottom of the waiting list, which could be in the hundreds of days that you waited for that spot in the first place. So things like that. And then obviously fast-tracked regulatory barriers around, or regulations around approving products, like a self-swab for self-testing, or vaccine, or 3D printing masks. That would have normally taken a couple years, and it happened in a matter of days.
Mm-hmm. And so then how do we transition this into the kind of changes that we see for the people whose roles are home care and the role of family caregivers?
I think a lot of the more active family caregivers who have really actually, I think, been part of shaping the future, because the whole reason I have a job and we have a job is for them and their families. They kind of know what they want. And I think now it's how do we make sure that they're helping co-design and co-lead, as these changes get made. And I think that is the risk. And we've seen that for sure, that when you go into crisis mode, you kind of get quite, hierarchical and just get on with stuff. And you might not bring the right people to the table. And I think we're seeing that quite a bit. So I think just be involved where you can and push yourself in to the design. And again, I think just demand more, challenge, be creative. We've all had to be creative to survive our lives, right? So let's be creative in how we try to keep our people healthy and safe, and bring millions of problem solvers to the table, instead of the small handful of administrators in our healthcare system.
Perhaps maybe you can give us some new updates on some revelations that have happened from maybe even the last time we spoke, just in regards to what you're saying.
There's been a lot. So a few, I think it's been amazing for me to see this new language emerge called the essential economy. So I had reflected last time that after when the Black Plague hit in Europe in the 14th century, there at the time there was the lords, and then the serfs, the peasants, who kind of had to do the farming, and really they're almost like slaves. But when all these farmers started getting dying in the rural areas, all of a sudden these farmers that were left became the most important people, the only important people, and so a whole new power came out, and that is really emerging. So we're seeing massive spikes in hazard pay, hourly pay, incentives, perks for our essential workers, and they're just being elevated. And we're kind of done with the hedge funds and all of us sitting at corporate. And I just keep seeing more of that every week, not only in healthcare, essential economy, grocery, and our postal workers, and everybody that actually keeps this place going. So it's going to be exciting to see that play out even more, and I think stay. And I've got thousands of others. I keep an inventory of all the innovations that I've seen around the world. So that's like a 7-hour webinar. So let's do that another time, please.
And so what are some of the key things that you feel like we should be watching for in the future?
So in healthcare, I think it's going to be seeing some really new models of care that let's pretend we didn't inherit the healthcare system we have, because every institution we've inherited, that goes all the way back to how we train doctors in medical school. Like, these are 100-year-old institutions, and institutions are institutions because they're meant to never change. Like, you've basically stifled out all innovation from them. They're preservatives, of the highest order. So now, because those aren't really working for us at all anymore, imagine if we had a clean sheet of paper. We got to design, how do we want healthcare to be done going forward based on the needs of today's population? Almost 20% are over 65. We have complex illness. We have mental health at a scale we've never seen. You would never have designed it the way we have it with this new set of needs. So we have digital. We didn't have that before. So I think we're now using this as a chance to rebase. So I would be looking at some of the really new models that are emerging, where pioneering clinicians, citizens, tech partners are just getting on with it. They're not waiting for a committee to have a task force, to have a committee to write a paper, to have a study. They just do it. So that's around primary care, around senior care, around just dealing with people with really messy diseases like kidney issues and COPD. How do we keep these people healthy and safe despite the inability to be in person?
Mm-hmm. And I mean, given what's going on globally, and as we see us getting closer and closer to flattening this curve and really becoming this new reality, us as individuals, we are going to demand more. But what is the push that we need to do to really effectively create this change?
I think I've hinted at a lot of it. Right? Is demand it, expect it, experiment. Challenge yourself and your assumptions. Be willing to try stuff. It's not going to work, then you should do other things, just like we're all doing every day. Like, I had beautiful visions of how my children were going to do homeschooling every morning. No. Okay, I'd try something else, and same with my children's teachers are going through their own version of that, and and how I engage with my family. Anyway, so I think it's that. And then at the same time, for those who are able to have influence, whether that's, in your municipality or whatever, like some of my colleagues that are all chatting away on this thing, is really use that power very smartly, very strategically, insert yourself, and make sure that the best thinking is coming forward from the people who have the most closest stake in what's going on, right? Whoever's closest to the care. And that's what I suggest, we collectively do.
Okay, Zayna, thank you so much. 20 minutes always flies by, and I feel like we could have been here for 7 hours and that would have flown by as well, just given your content and the amount of valuable information that you have to share. I just want to say thank you for everyone who tuned in today, but I'm sure many of you still have many questions. And so if you do maybe want to book Zayna for a custom virtual event or for consulting, definitely shoot me an email. I'd love to get you connected. I feel like just reading this comment, like I'm in this belief as well that we can never have enough of Zayna. And so this definitely won't be the last time that you guys will see her on this platform, I'm sure. And I want to put it out there that most of our speakers who do get to be on our virtual speaking series have been coached by one of us. And so if you are interested in delivering on a similar level as Zayna, we are launching a beta, which we're only doing once for the lifespan of this service. And so if you are interested, definitely shoot me a message after this event. We will be continuing our virtual speaker series tomorrow with Dr. Sherry. Dr. Sherry will walk us through how to protect your most important relationships amidst this time. And so we are going to continue that conversation from our last Lunch and Learn as well. And so there's definitely a lot of gold to be had with that one too. And so I want to again thank you, Zayna, for being here. Thank you all for tuning in today. And just lastly, take care, stay safe, stay healthy, stay connected, and we'll see you all soon.
Bye.